Welcome to the Low Carb MD podcast. No one is beyond help. No one is beyond hope. Nothing said on the Low Carb MD podcast is medical advice. Please consult your own doctor before making any lifestyle changes.
Hello and welcome back to the Low Carb MD podcast. Unfortunately, everyone, don't be disappointed, but Tro had a conflict on his schedule, so you're stuck with me for an hour. But luckily, I have a great guest, and it may make things a little bit more fun and entertaining. And this is this topic, and hopefully we can get into it. We'll talk about personal stuff, and so Erin Bellamy, welcome, doctor, I should say, psychologist and metabolic health practitioner. And so this is awesome. I'm an MHP also, so we kind of went through the same training, so that's awesome. So tell people your story.
Yeah, absolutely. First of all, thank you for having me. And yeah, unfortunately, we don't have Tro, but we're going to have a great time chit-chatting for the next hour, as you said. It's actually lovely to be hanging out with somebody who is an MHP. You know, it's a growing society. But I feel like I have a special bond with other people that are MHPs. So yeah, it's nice.
Yeah, so for people who don't know, that's metabolic health practitioner. We go through training and kind of learn all the science. And so one of the biggest really good outcomes is on the mental health front. We're at a major crisis in mental health in the United States and the UK, where Dr. Bellamy is coming from, and to say, what else can we do rather than just throwing drugs and maybe some counseling? How do we really help that person who's struggling? So yeah, I would love to hear your story of how did you get into MHP and understand the benefits of mental health with lifestyle change.
Yeah, absolutely. So I'm going to try not to repeat myself if people have heard me on other podcasts, but it goes back a while. So back in 2014, I was working in the National Health Service here in the UK. I was working on the inpatient psychiatric wards. So, you know, where people go when they're not feeling very well, maybe they need to go in under maybe like a mental health section. They may have to be kept in for a period of time, either voluntarily or, you know, sometimes against their will. So more often than not, people are not in a good place. And so I was working there for a couple of years because my goal with my background in psychology, my goal was to be a clinical psychologist. I wanted to work with people. I wanted to implement psychological therapies and help them to the best of my ability. And so in order to get on to the clinical psychology training, you had to get some sort of like experience on the inpatient unit. So that's what I was doing. During my undergrad and my master's degree, so I did a master's degree. My undergrad was in psychology in Dublin, where I'm originally from. And then my master's degree was in psychiatric research in King's College London. And during both of those degrees, my interest had always been in eating disorders. So my thesis in both of those degrees were on nutrition in young people, binge eating disorder in young people, and how stress and exam stress affects eating. And so that interest was always on the side for me. And so when I was working in the NHS, I remember being on a night shift and I was just on the computer on my break and just kind of looking around at the latest diet. And you probably remember this, Brian, back when Dr. Westman had just revamped, I think it was new Atkins for a new you.
Yeah, exactly.
And so I had come across that and I was like, oh, what's Atkins? What's this? Led me down a rabbit hole of like low carb and South Beach and all of these other diets. And I went on PubMed to see like if there was any research on like what the research was saying. And the research was predominantly around its effects for type 2 diabetes. I was like, oh, this is cool. Like, this is interesting. Pretty much all of my patients have type 2 diabetes because, you know, they are heavily medicated, you know, they're eating the food that's on the ward and it's not exactly highly nutritious in the way that you and I know. And so I thought, oh, well, this is interesting. I wonder if this could be helpful for them. I had to read through some of the findings, and some of those secondary outcomes were, you know, the ketogenic diet or low carbohydrate diet also showed improvements in mood. And I thought the usual, oh yeah, well, of course your mood's going to improve if your diabetes is improving and your blood
Or if you're
glucose
losing weight and people are
are losing
nicer
weight.
to you and all that stuff too, right? Yeah,
Yeah.
for sure.
I was like, yeah, that makes sense. But then some of the papers were saying, independently, like the mood was improving. Oh, that's interesting. So I continued my search. And then I started being more specific with my searches. And I was putting like ketogenic diet and schizophrenia, ketogenic diet and bipolar disorder. And as everybody knows, if they've listened to anything I've said over the past couple of years, there was one paper from 1965, which was a pilot study, ketogenic diets for schizophrenia, where they had 9 women. They put them on a ketogenic diet. Their hallucinations, delusions, and symptoms improved over 2 weeks. Then they gave them their standard diet back, and 70% of them, their symptoms came back. And it was that paper that just changed my life, because I thought, what? This is phenomenal. The people that I'm working with have schizophrenia. Like, this is cool. Like, this definitely, there's something here.
I get goosebumps hearing this and
Yeah.
frustration too. I'm not even aware of that study from 1965, right? And
Yeah.
you think, wow, go and look at the literature and you look 1965 and you wonder how many people have suffered, struggled, committed suicide because no one looked at the nutrition aspect. And when Tro and I talked about this in 2017, 2018, well, specifically,
Yeah.
I got attacked by doctors for 4 or 5 days, just ridiculous, relentless, saying diet has nothing to do with mood, right? And I was like, how can you possibly say that? Right? Especially when I wish I had that study from 1965. I could say, well, here's one from 1965. We knew this back then.
Exactly.
But
Exactly.
that their symptoms got worse and better. And one other thing I just want to jump in real quick is that what you're talking about, the diabetic ward, the correlation with depression, major depression and diabetes is unbelievable. And when you look at the data, you wonder, is it that they became depressed because their sugars were so out of control, or because their sugars were out of control, they became depressed? And so the reality is, when they looked at the data, the sugars went out of control first, and then they got depressed, right? So you start realizing it wasn't that they just didn't care and their sugars went out of control.
Yeah.
It was
Exactly.
because the sugars, it's this metabolic component of it that's so critical to what you're doing.
Absolutely, absolutely. And we're going to talk more about that for sure. That metabolic component that is just at this point an umbrella, for so many underlying characteristics and symptoms. But that paper, you said it excites you and it frustrates you. The same for me, because I thought, oh my gosh, this paper is fantastic. And an RCT nonetheless, okay, questionable. It wasn't beautiful and packaged up like, the NIH funded ones, but it was good. And then I thought, okay, well, what else? Like 1965 is like 60 years ago. Like, what else is there in the research? And there wasn't anything. There was like a couple papers from 1974 where somebody had said, they'd gone out to Polynesia and they said schizophrenia is rare where grains in the Western diet is rare. But yeah, go figure. Like, other than that, there was nothing. And I thought that it was me just not doing a good research job. I thought, like, where is, maybe my terms are off. Like, where is that research? And it just wasn't there. And then I became frustrated because I thought, where this has been hiding for so long. And I had got excited thinking, oh, well, this might work for people. And then, something came and like pulled me down, because I thought, well, I can't help people now because there's no other research to show that it does or doesn't work. So now what am I going to do? And so that's when I decided I needed to go off and study it and do the research myself to really see if it did work. And then if it did work, then I would be able to practice clinically, which was always my dream, practice clinically with people to implement this instead of using, or as an adjunct to using, standard of care. And so that's what I did. 2016, I started my PhD on ketogenic diets for depression, and finished that up in 2023. And now I opened my clinical practice, which was always my dream. And now I do exactly that. I work with people and I implement ketogenic therapy and other metabolic therapies, specifically to improve metabolic health, and then more specifically, psychiatric conditions. So bipolar, schizophrenia, depression, the whole 9 yards, binge eating disorder as well. So yeah.
Okay, so this I'm so glad to talk to you about this, because the reason that we started talking about it is I was treating people for their diabetes problem and weight issues. And all of a
Yeah.
sudden they're saying, I'm happy, I'm singing again, I'm talking to my neighbors for the first time, I'm going for walks and enjoying nature. And one of my patients, we were doing there was a documentary called Fat Fiction, and they were talking about a ketogenic diet for reversing diabetes. And they had 5 of my patients that they were interviewing and telling their story about reversing their diabetes and or putting into remission, whatever you want to say.
Mm.
But all of them said that their mood was the most important thing to them. Their mood got better. So to take someone out of anxiety, depression, all these things. And so I saw the psychiatric benefits of this, but we were treating something different. Now you're saying, now I'm treating the psychiatric benefits. Now you're going to be seeing the metabolic benefits, and these people, they're like, oh, I don't need so many medicines, no, so many diabetes medicines and things like that.
Yeah, exactly that. And so again, it comes back to metabolic health being the umbrella. And one of the coolest things that I get to say to people is, they'll say like, well, how likely am I to improve? Will I reach remission, etc. And I can't say, yes, you will reach remission, right? We can't say that just yet. But what I can say with, a decent amount of certainty is your metabolic health is going to improve. Like, we have so much research now, like decades of research to show that that is the case. And if we consider that that mental health is metabolic health, well then, because the brain's connected to the body, the brain is going to be impacted. And more than likely, you are going to see improvements there too. So it's, I'm as obsessed now as I was, way back when I started researching. I'm just so excited to be in this area, actually being able to give people hope, that perhaps something actually might work for them, when up until this point, a lot of people are treatment resistant, or a lot of people are on multiple medications for their mental health and for the knock-on metabolic effects of their medications and all of this,
Yeah, and the medications can worsen metabolic health, right? So people gain weight, they feel terrible. So when I heard about Chris Palmer, I was a skeptic myself, even though I saw it benefit bipolar and depression.
Yeah.
He was talking about schizophrenia. I was thinking, oh, most doctors are afraid of schizophrenia because that's such a hard thing to treat, because you have someone who's so paranoid that you give them another pill and they're thinking you're trying to kill them, right? And so, or that they're hearing voices. And when he started telling me his clinical experience and saying, look, the same medications we're using for schizophrenia are the same one we're using for seizure disorder, and seizure disorder benefits from a ketogenic diet. When these people start making these connections, and we're talking about other metabolic issues, like Parkinson's disease, Alzheimer's disease, brain tumors. There's all these things where people in oncology, neurology, they're using the same lifestyle treatment.
Yeah, exactly. And you can approach that, that work with a little bit of skepticism in the beginning, but then when you learn that, you know, there's research to show that people with schizophrenia have altered carbohydrate metabolism issues. And that research came out in the 1930s. So I was checking recently, I thought it was like 1958. I found a paper, but then I kept going and I found information to suggest that even back in the 1930s, scientists knew, or were aware that people with schizophrenia had altered carbohydrate metabolism. And then you're like, the information is out there. It's just about pulling it all together in a multidisciplinary way, right? Because we've got oncologists there, psychiatrists there, these people there, and the information is spread all over the place. Just about finding it and pulling it all together, because once you put those puzzle pieces together, it makes a lot of sense. And even if we think about in Germany and in Russia, in the sanitarium, so through their state health system, they were, back in the early 1900s, they were fasting people, therapeutic fasting with people who had schizophrenia and bipolar disorder and catatonia, with 70% success rates, putting things like schizophrenia and bipolar and such into, I guess, what we would call remission. It's just that those papers and those records are still in Russian and haven't been translated yet. So we know that to be true too. We just haven't got all the
Yeah.
information
And
yet.
and even when you think about going back to biblical times, they said, these
Right.
evil spirits can only be controlled by prayer and fasting. So fasting, maybe these people start fasting, their brain runs on ketones and their mental illness gets better, and they go, okay, we cast out that demon, right? That may be part of this whole
Right.
thing. But it's really fasting. We see that with people with advanced Alzheimer's disease when they stop eating and they're in the all of a sudden they get this moment of clarity and they start talking and saying, oh, remember to pay this bill, here's where I hit all the documents, that kind of stuff. And it's really remarkable that you just get this energy in your brain again, and then you wonder how many of us are just dull and like we can't think and we're exhausted all the time because we're eating terrible foods all the time.
Yeah. What if you're putting your body under that much pressure to constantly be digesting and dealing with the environment 24/7? How is your brain going to be functioning optimally? Like when you fast, even if you do something like a 16/8 fast, the clarity that you get in your mind is incredible. Um, I don't know if you know, but I think it was Pythagoras. I teach this when I'm running my group programs. Pythagoras said that he wouldn't allow any of his students into class unless they had fasted for 40 to 48 hours previously, which I thought was quite funny because I was terrible at maths and I can't remember Pythagoras' theorem. So, like, if his classes were that tough, like, I get it. You would need like ultimate focus to go into his class, but it's been around
Wow.
for so long.
Yeah,
Hmm.
that's so interesting. And a lot of people do that for they're fasting for mental clarity. And a
Yeah.
lot of times if we're going to give a talk or something in the after, we'll just fast that day so you have better mental clarity. It may not seem like it, but yeah, we're better than we are baseline. But I think there's so much that you've uncovered talking about this. And the sad part, and I think this is probably what you're going to find, is when you see this study in 1965 and then you don't see anything about nutrition again. It's the same thing we saw in medicine after 1921. Before 1921, what do we do? Ketogenic diet, where people hospitalized, they put them in there, cut off their sugar, and waited till they didn't pee out sugar anymore. And they go, okay, this is the diet you should be on. But after 1921, we got insulin, so they said just give everyone insulin. So with mental health, they said, oh, we got drugs. We'll just give everyone drugs and make them feel better. You don't need to worry about diet. We'll just forget about that. Instead of saying, hey, let's do both and see what we come up with.
Yeah, exactly. That's exactly it. Because people started asking me when I started saying, like, where is the research? People started then to ask me, like, well, what do you think happened? Like, what happened between then and now? Why is there nothing? And when you look then at the trajectory of introduction of antidepressant medication, antipsychotic medication, and how psychiatry just went off in that direction, that became the model. Psychiatrists use medication and they're meant to also use therapy, but more often than not they will usually only use a medication approach, and that's just the way it went. Should it have gone a different way? I think you and I would probably both agree that yeah, it should, or they should have at least been run in parallel, to give people the option. um
Yeah, and see
but
once
we're
you
here now, I
stabilize.
guess.
Yeah, and so we could bring that up. One thing I've noticed over my career, right now, getting someone to a psychiatrist is like, forget it. Like you're gonna wait 4 to 6, 8 months sometimes just to see a psychiatrist when you're in the throes of depression, schizophrenia, and
Yeah.
so that's a tragedy. But then the bigger tragedy is the psychiatrist. Every patient I talk to, I was like, "What does your psychiatrist say about your marriage stuff?" And like they don't talk to me about any of that stuff. They go, what are your side effects? Can you tolerate the medicine? Let's check your levels. We'll see you again in 3 weeks or 6 weeks or whatever it might be, right? And they never even talk about lifestyle, stress, sleep, all these other factors. So that's why the psychologists have been such a huge bag, because it used to be psychiatry talk to the patients. Now it seems like it's all drugs.
Yeah, exactly. And so recently I wrote a paper with a couple of my colleagues for specifically for the clinical psychologists and the people in that area, because they have a role in this. If we are going to make metabolic psychiatry this new field, if we are going to push this forward and have ketogenic metabolic therapy be something that's accessed by all, then we need clinical psychologists on board, because they need to talk to these individuals about the power of sleep, the power of light and movement, the power of the ketogenic diet, how to use it, how to stick to your routine, all of those things. So they have a role in it as well. And I think perhaps up until now they are just kind of keeping they're kind of looking in from the outside, perhaps not knowing where they fit. And so that's why we wrote that paper recently, to kind of draw them in, because they do have a valid role in this. It's not just about psychiatrists. The other thing is, just like you said, like I'm in the UK, but it's very much the same as you in the US, which is people are waiting a really long time to see a psychiatrist. In the UK, I mean, I have like I can think of a couple of the people that I work with, and they need medication changes right now. Like their medication needs to come down because it's currently too strong, and they cannot see a psychiatrist in order to get that medication reduced. And I can't tell them, it is not up to me to tell them what to do because I'm not a psychiatrist. They know that their medication needs to be reduced, but they cannot do it. And there's no psychiatrist that's assigned to them, perhaps because there's a changeover of staff, or they're waiting a really long time before they are going to be seeing someone. So it's a tricky space to be in, and it removes the control from the individual. Whereas when we use ketogenic therapy, what we see actually is a lot of people feel that, like, wow, finally, I can kind of control some of my symptoms, or I can take steps to make myself feel better and do everything within my power to feel good. And that's not often how people, with these diagnoses feel. So yeah, it's a switch.
Yeah, and it's true. And even from a primary care, we should be able to manage those meds too. But
Yeah.
bipolar, we feel comfortable with. Depression, anxiety, those kind of things. But
Mm.
schizophrenia, like even when a patient says, "Hey, I've heard your podcast talking about these things," I always make sure they're under the care of a psychiatrist, and then I'll add in the metabolic health, right? Because I'm scared of it's going to take time for these things to kick in, and so one of the big things with some of the antidepressants, like when Prozac first came out, when people are super depressed, like really depressed, laying in bed, they don't even have the energy to try to hurt themselves. So what the
Yeah.
psychiatrists did, put these people on meds, and then they started feeling better. Then they had the energy, so the suicide rate was going up because they weren't being
Mm.
monitored closely, and they weren't being talked to and say, how's life and how are things and how are you feeling? And that's why psychologists are so important to really get that, because I've had psychologists call me and go, something's off with this patient, right? And we can work together to try to get that patient healthier and feel better.
Yeah, exactly. And that's so crucial. Definitely in the UK, we need a little bit of a switch in terms of how the multidisciplinary team works, because it's a little disjointed at the moment. But best case scenario would be that, you'd have a therapist or a psychologist assigned to someone. They would also have the psychiatrist. Maybe they'd have like a peer support worker or something else that they can also talk to and engage in. And then they have also somebody else on their team that would be focused on metabolic health and improving that. I feel like I can see that in the distance on the horizon. It's not right here, right now, but that would be the ultimate outcome, so that person
Well,
could get all around care.
and people like you who are doing studies and publishing and talking about it, it's so important so that people know that, because someone like you who didn't know about metabolic health stuff, once you see that, they always say you can't unsee what you've seen. And so once you see these people, getting their lifestyle better, so many people I've seen, even with
Yeah.
panic attacks, which are really scary when you get panic for no reason. It's not like you're afraid of going on elevators or something you can put your finger on. When you just are sitting there relaxing, and then all of a sudden you get these panic attacks, it's so scary that you think you're dying. And so I've had patients who say, you know what? I now know I've been to the ER 6 times. Every time my heart's okay. Now I just breathe and tell myself it's okay, and they can come out of it without taking a drug and controlling their breathing, and so many of these things that overlap. And the other thing maybe we can address is adverse childhood events and what we're dealing with metabolic health and sympathetic overdrive and being stressed all the time. Maybe you could touch base on that a little bit.
Yeah, absolutely. And so, Dr. Chris Palmer does talk a little bit about this, and he can even bring things like PTSD. So if you have a lot of adverse childhood events or ACEs, and say if you have a traumatic experience as a child and you have developed PTSD, he's even suggested that even that can go back all the way back to the mitochondria and the upset of mitochondrial health. But the way I look at this is, and this is the way I explain it to my patients as well, and to my clients, is it's a pyramid. The bottom of the pyramid is a strong ketogenic foundation. because I think nutrition is the foundation here, right? If you've got low vitamin D, it doesn't matter how much mindfulness you're doing, you're likely to have a problem. You're likely to have, you're likely to be depressed. So I always put that at the bottom. Then on the middle layer, I put other metabolic interventions. So sleep, light, exercise, social connection, and so on. That goes in the middle. And then at the top, I put, if you've got any like lingering issues that perhaps haven't resolved once you've targeted the first and second layer, then you might need to go and see a specialist. So, there are some people, for example, who have lived in a house with a ton of mold and they're dealing with that, or there's some heavy metal toxicity, and that's outside of my remit. That's not what I do. And so if things haven't resolved for them, then I will recommend them going elsewhere to get that support. But things like stress reduction, good sleep, morning light, lunchtime light, dimming of the lights in the evening, movement. If you're a woman, making sure that you are exercising and fasting and doing all things in, in relation to your cycle, all of those things have to be considered too. And you have to kind of approach that with caution, because in the beginning, if I was to say that to somebody who is feeling really, really low, can't even get up off the couch, cannot make regular meals for themselves, can barely, go to the grocery store,
Yeah.
hasn't cleaned their apartment in weeks, and I tell them that they have to do all those things, like they're not even going to listen. They'll just ignore me, and they're not going to even make a change. So I start with the nutrition first. Like I said, it's the base of that pyramid. And once they're in ketosis, and once they experience that, and they create what I call, which I'm sure you've experienced, this kind of buffer space, you get this space between, what's going on around you and how you react. You just suddenly have more capacity to do things. And once they experience that and they have the eating down, then I almost don't even need to ask them to do these things. They just say, you know what, like I felt like I wanted to go out for a walk. And then we'll talk about, okay, how to do that for the maximum benefits. And, I got a bit stressed out. And then we'll talk about, okay, well, what could you do in that circumstance? What might be helpful for you to try and experiment with? So it's definitely a step-by-step approach. But to come back to your question, all of those things are so important because they're still metabolic therapy. So you're still improving your metabolic health with those, stress interventions and sleep interventions and so on. But you just got
Love
to
it. Yeah, I love it. I love it that you're talking about it for a lot of reasons. But one is on this podcast, we had guests on that we would talk to and say, how'd you, and some people was faith, some people was different things that they did that helped them to relieve their stress or found a new hobby. But when we talked about like people, we don't want to talk about this is low carb. We want to talk about low carb and ketogenics. Like, well, that's part of it because I know from clinical experience, if you come to me or someone comes to me and they're a busy real estate agent and they're stressed and they have two kids, one of them's on drugs, one of them's out, acting up, it's hard to lose weight. It's hard to get metabolically healthy when you're in this constant state of stress. And when I start talking about stress, faith, all these things that are also part of metabolic health, is not just what we're eating. Plus, if we're constantly stressed, we're less likely to stick to it. As you mentioned, you had an interest in binge eating disorder and all, and you realize when people are more calm, they're less likely to have to binge eat because you're okay with life. You don't take drugs a lot when you're enjoying life. No one's stopping in the middle of a massage or something they enjoy to go eat cookies because they're being at peace right now. So this peace is so important, and it's so important to our mental health. That people, and the other thing we talk about is things like connecting with your dogs and cats and going for walks and being in nature. There's oxytocin goes up, and that blocks the stress hormone release and all those things, and it plays a huge role. So a lot of people who are struggling with depression, anxiety, schizophrenia they want to please everyone else, and they think if they take care of themselves, they're being selfish, right? They're the most kind, decent people that I find, and they're like worried about everyone else, and they just don't worry about their own lifestyle or exercise.
Yeah, and that's what within my group, I because of my group program that I run every couple of months, I have a growing community, and there's not, I don't know, there's like 30 people in there, but everyone's so warm and supportive, and they've got all these different diagnoses. And then there are some like parents of people who have diagnoses, so they're trying to figure out how to help their kids and stuff. And they're also warm and loving to one another, and you would think the opposite because they have so much going on themselves. You would think that it wouldn't be like that, but they just want to share with one another like how it's going and what's helping them, and how to help each other understand what's going on for each of them. And I think society has developed an idea as to what people with mental health diagnosis, how they come across, which, as you and I both know, is not accurate. We very much need to look at mental and physical health conditions as just different parts of the body where there's something going on. There shouldn't be any stigma, but it does seem to be that way right now, though we're working on changing that. But going back to the support of one another, we've got people in the group where they were saying recently, oh, I went through a bad divorce, like I don't really know how to manage this. And then you've got somebody else saying, oh, well, sometimes I like to go to church. I don't really know if you're up for that, but like it seems to really work for me. Do you want to jump on a call and we can I can talk things through with you? Like I'm happy to support you. Like the support's incredible. And I think
so for people who don't know, tell them exactly what you're talking about, what you're doing with because I'm doing the same thing with my patients. So I would love to hear what you're like. How are you doing? Are you doing like a big Zoom meeting with all your patients together, or how are you doing that?
Yeah, so what we do is every 3 months I take on like 10 to 12 people in a group. And over 8 weeks, I take them through all the education. So I teach them all about ketogenic metabolic therapy, specifically for mental health conditions, exactly what to expect and what's going on. And I give them kind of personalized approaches to implement things at different time points so that from day one to the end of 8 weeks, they're in ketosis, they're reaching therapeutic levels of ketones related to their condition, and they're in their groove. And then every single week for 6 months, we have 2 support calls, like Q&A support calls in the week. And so the first call is just with that initial group because they all started together, so they get to know one another. And then the other call in the week is with everybody who, like people that did the program last year, people that have done the program this year. So you get a bit more of kind of like a mentorship.
Mentorship,
Yeah,
awesome. Yes.
exactly. And so, you know, having the small group where they've got like that personalized Q&A and feedback is great. And then the wider one where they can get to know other people and they can have like external calls. And then we got like just a Facebook group, a private one where they can all talk during the week. Like that's how it looks. And that seems to be working really well. And it's just so, again, going back to what I was saying about them getting to know one another and support one another. Like these people are from all over the world, like Finland, Finland and Sweden, Colorado, Canada, Mexico, and they're coming together with varying levels of mental health conditions and diagnosis, and they're just getting stuck in. They're just helping one another and learning and advocating for themselves, when they're speaking to their psychiatrists, and the outcomes are pretty astounding. Often people say to me like, is this going to work for me? And I can't say for sure, right? We don't know. But there are very few people for whom this is not working for. Like, yes, there are maybe 1 or 2 people that I've worked with where we haven't quite, they're not feeling as good as perhaps they expect to, right? And we haven't got to the bottom of it. But the majority of people are feeling good. Like people who don't
And
experience hallucinations anymore. Like
yeah.
gone.
Yeah, for people to hear that, it gives you hope. And then you say, okay, then that calms your stress hormones down because you're
Yeah.
hearing this stuff. So when I had my first patients coming off insulin, like someone else who just got put on insulin, go, look,
It
talk,
can be
like
done, right?
let's do it. And when they saw that it's a possibility, then they believe before they go, once you're on it, I have a
Yeah.
patient just yesterday I saw, and they told him you're type 1, you'll be on insulin the rest of your life. So he came
Right.
in, I check his C-peptide. I go, you're making a good amount of insulin. It's just not you're super insulin resistant. So he goes, there's something I can do to come off insulin. Yes. And so, right. And so there's a hope, and you can say there's things we can do. And then also the importance of group meetings is just like with anything, the people who don't come are the ones who need it the most. right? Because they're struggling. But sometimes I'll have someone come on and I love it because they'll come in and go, I wasn't going to come today because I've just
Yeah.
been blowing it all week, and I turned to cookies on Tuesday, and then someone else will pipe in and say, and there's no judgment. Everyone goes, you know what? 3 weeks ago, I was in the same place. Here's what I did. Oh my gosh,
Yeah.
me too. Like, oh my gosh, I was having a hard day. I didn't want to say anything. And then boom, everyone's having a great time. And those are our most effective meetings when someone's vulnerable enough to say, yeah, I'm really struggling this week. I'm fighting with my family or whatever.
Yeah, I love that, and I always thank those people profusely at the end. Even this week, somebody he just like they turned up, and they I could tell I already knew I had a sense because of where we were in the calendar, like what would have happened, and they were just like, I didn't really know if I was gonna come, but I'm here now, and this is what happened. And we were like, come on, you got this. Like, you've done this before. Like, let's make a plan so that next month when XYZ happens, like, you know what you're gonna do. He was all like up for it then at the end. And then because he had shared that, somebody else piped up just like you said and was like, well, you know what? Like last month I felt that way and this is what I did. And I say to people from the get-go, from the first day that they join the program or the first day that I work with them, like if it's one-to-one, I just say, I don't care what kind of week you've had. I don't care. I don't care, especially for people with binge eating. I'm like, I don't care if you have eaten 10,000 calories a day, you have hid the wrappers, wrap them in tin foil, like hid them from your partner. Like, I don't care if you've eaten in the dark, like, and I don't care what you've done. You just need to come to the meeting. You need to show up. You can sit at the back and not say anything, right? But you just need to come. And when I
Yeah.
say that in the beginning, I think people are a little like, they're like, oh, well, whatever. Like, that's not going to be me. Like, I think they just think, oh, she's being a bit extra. But after a while, once they're reminded multiple times, then they do come and they
I love
do
it. I love
come.
it. And that's the other point is some of my patients, they're like, look, I don't like group stuff. And I'm like, no problem. Just turn
Yeah.
your video off, turn your audio, just listen to what people are saying. And then all of a
Yeah.
sudden in a couple of weeks, they're like in the middle of everything. Their videos on, their audio, like, hey, what about this? Have you guys tried this? And once they feel
Mhm.
accepted and loved and cared for, like you can't
Yeah.
fake that. That's real. Where people really, really I have patients that they're doing Zumba together now. They go, we live like 2 blocks from each other. Let's go for a walk in the afternoon. Let's go, and you have that companionship. Now that's going to help your mental status like so much, you know.
Like a tenfold. And, when I did my PhD it was the first randomized controlled trial for ketogenic diets and depression. However, the main limitation, the number one limitation, the thing that like took it down was it didn't have group support. It didn't have a support element. And this is back 2016, 2017, where I was using a remote care model and apps were barely even a thing. So, the group support wasn't part of it. And for something as difficult as this or as challenging as this can be or can feel in the beginning, it was a necessity. And people were not able to see it through to completion without support. The people
Yeah,
that did well were people that were supported by their family, by their friends, and they managed. But the other people didn't. And I think it is the single most
yeah.
important thing. You have to.
Absolutely. That is so important because Tro and I have said this from day one. It's really, we see who's going to fail.
Yeah.
uh Number one, stress. If you go through life stress and you turn back to your ways of dealing with whatever it was. And then number two, lack of family support or social support, because if you don't have social support and you're the only one who's not eating, and your family's eating pizza every night and you're trying to eat steak, it's not a
Yeah.
it's so hard. But when people have supportive family, and the other thing that you said earlier, just I just wanted to address that, is like once you get the diet right, the nutrition right, everything else the mental health seems to get improve. And so I do a lot with couples because I like to have couples do it at the same time, because the success rate goes way up because there's peer pressure. Like when he wants to eat cookies, she said, no, let's not eat cookies. We'll do it tomorrow. And then tomorrow he's strong and said, we're not getting. So having someone
Yeah.
who's strong is what you need. But what I find is we'll be talking outside. So how's everything at home after 3 or 4 weeks or a month? And the husband will
Mhm.
kind of look at me and like thinking, should I say it or not? Then he'll look at her and go, honey, you've been so much more calm, and like things that used to upset you, they're not bothering you anymore. I'm waiting for your reaction and you're not. And then she'll say, what do you mean? And then they start talking. She's like, oh, you're right. It doesn't. I've been, and so when you calm that stress hormone down, and that's why the other thing that was controversial, Tro and I talked about, we saw people saying, I don't need to drink as much and I don't need, well, Tro, the really controversial thing was when he says, he had guys self-reporting that they stopped looking at pornography and they started having more connection with their spouse. And it has to do with this, how do you deal with your stress? You come home with a job you don't like and you're stressed out all day. You're looking for that relief, and so it could be binge eating. For some people, it could be smoking, drinking, video games,
Yeah.
locking yourself in your room and listening to relaxing music, whatever it may be, is that we're escaping that life's not working very well.
Yeah, exactly. And that just makes me think about the addiction model. And we live in a society, I think that the rates of addiction are so much higher than we know. And even if we look at the rates of binge eating in the population, that's highly and wildly underestimated or underdiagnosed as well. Throw in a little bit of ultra processed food addiction and I'm sure we're, 20+%, maybe even higher. But what I see with people is when you are in ketosis, the food chatter, the food voice, the binge eating voice, it quietens way down. And it's the same voice as people who are smoking, people who are addicted to drugs, people who are gambling, people who are addicted to pornography, all of these things. It's the same voice. It's the midbrain that's responsible for like fight, flight, and making you survive. That's what's piping up all of the time. And when you are not overwhelmed, when you're in ketosis, the ketones, those little molecules are anxiolytic, so they're reducing anxiety. They're antidepressive, they're reducing depression. They're increasing GABA, so they're calming you down. When you're in that state, and that's your default state, it's difficult to trip in to this overwhelmed state and having that binge voice, food voice, whatever you want to call it, have that shout so loud that you can't control yourself and you go into autopilot. So it's nice to have people be in that state as default, because then the body and brain has to work a lot harder to trip into, the old habits. And I've had people say that, when they're in ketosis and they're walking the aisles of the supermarket, whereby previously they would have spent $30 on just Twinkies and then eating them around the back of the shop, right? They are able to walk past these shelves full of things and just observe, almost like this perspex between them and those items, and then get what they need and walk out. Like
Yeah.
I don't know of any drug that can do that.
Yeah, Ben Azadi, who's become a friend of mine, he's has a book coming out called Metabolic Freedom, and I was like, that resonates so much with me because so many people have that freedom because they were hostage before. They couldn't go buy the Twinkies or crisps or whatever it might be, and they
Yeah.
couldn't do it. Now they're like, oh yeah, I don't need that. I feel good. Like I'll have something that I know is good for me, and especially I think the thing that always comes up with a ketogenic diet or a low carb diet or any of these metabolically healthy nutrition plans is people say it's unsustainable. But if you come from seizure disorder, people who have seizure disorder and they put in remission, they're like, the risk and benefit, like forget it, I'm not cheating. And a lot of people who aren't as metabolically sick can say, I'll have a glass of wine here and there, I'll do these things. And the other important thing that I love from the psychological standpoint is all patients who are doing really well. And one of my patients in particular, she's doing fantastic, and she said, okay, you're gonna get upset with me. And I go, why? She said, I'm having a girls' weekend like next weekend on Friday, and I decided I'm gonna have some pizza and some wine. I'm like, I'm super happy because instead of you saying I'm not going to do it, then doing it, then you feel bad about yourself and you're miserable. You've planned ahead and you go, okay, if I gain it 6 ounces or whatever it is up from that, then I'll get back on track. And to be able to be in control to say, yes, this is what I'm going to do. Right. And then sometimes they get there and they go, I decided I didn't need wine, so I didn't have it. And you go, wow, that's great that you didn't have to do it. But
That's it.
but to be in control again is really important.
Yeah, it's huge. And it's the planning rather than working in as a reaction, And going back to what you said first about it being hard and it being difficult, like if you were to ask me, like, what's the number one thing that gets you up at night and gets you frustrated, it would be that. It would be people saying, oh, this person has schizophrenia. There's no way they can change their diet. I'm like, back in 2017, I was working for a company that or I was working with a company that creates like MCT oil, MCT powder, and things like that. And we were doing a lot of research, and I was running the coaching side of the business. And I was coaching groups and individuals to lose weight with ketogenic diet and fasting. And people did well, but more often than not, they fell off. They fell off for social situations and birthdays, and
Mhm.
they struggled to bring it back around. They struggled to get back on board because they were at that point then just looking to lose the last 10 pounds. So really, is that the biggest why for them? No. Like when you weigh up having birthday cake at your daughter's birthday versus losing the last 10 pounds, for them, the cake was warranted, they felt, right? It wasn't such a, there weren't that many repercussions other than gaining some water weight after having the cake.
Mhm.
Whereas when I started working with people to do this for their mental health, and they saw hallucinations and delusions disappear, their suicidal ideation stopped, they're no longer anxious and having panic attacks. Their PTSD levels went from the highest they could possibly be on a measure to zero. When you tell them to go and eat carbohydrates and come out of ketosis, they will politely tell you to go in the other direction. There's not a chance in hell that they are going to do that, because they know for a time, if they do that and come out of ketosis and their levels drop, those symptoms can come back quite quickly in the early days for them. And therefore, you ask them, is it hard? They'll say no. No, it's not hard, because having those symptoms, being out of work and having hallucinations for 6 to 8 hours of the day is so much harder than eating a chili bowl with sour cream and cheese and olives all mixed in at a decent ketogenic ratio. So
Yeah, and he's saying that, it's funny. My sister-in-law reached out to me. My niece has autism, and she was
yeah,
acting out and agitated, and it was like they couldn't take her out places. It was really, really getting bad, and she had gained a ton of weight because of the meds and everything else. So they asked me, and I said, I hate to like I go watch this movie called The Magic Pill, right? Because there's a girl on there who's you
I
see
really
this
love it. Yeah.
dramatic change, and because she like my niece was living on goldfish crackers and cookies, and like, and when they tried to give her real food she would freak out. Like, oh, you're gonna have to go through that. But see, she lost weight, she started exercising, her mood got better, she showed empathy, and all these things changed over the next 6 months, and it was dramatic, like unbelievable. Like they would call me like crying. And the 4th of July came, and they had family visiting and all that, and she started eating all the food that everyone was eating and all that. And all of a
Mm.
sudden she just disappeared. And they're like, where is she? She was engaging before, now she's not. And she was up in her room crying. And she says, my brain doesn't work right on this food. Like she knew it. Like she inherently knew that her brain my brain's not working right. So they put her on back in nutrition and exercise, and she's doing great again. But it's
Wow.
amazing. Like we inherently, and the other part of that too is we have this fantasy, those of us who struggle with weight and binge eating, we have this fantasy about eating cookies or donuts, whatever it is. But so many people, when they eat it, they go, it didn't even taste good. It's not like I remembered. And I felt terrible for 2 days. My stomach hurt, my joints hurt. I felt grumpy. And they go, it's not worth it. And then you can tell yourself it's not worth it, right? It takes that romanticism out of it.
Yeah, absolutely. Absolutely. I'm so glad that she was feeling better. Just, and the fact that she was even able to say, my brain is not working the way it should. If
Mhm.
only more people were able to articulate that, as adults too. But I don't think people even realize the people that are sub-threshold diagnosis don't have a diagnosis. I don't even think they know how good they can feel, if their brain was firing on all cylinders, because the level of brain fog that people are walking around with, I'm sure, is astronomical if they're eating 195 grams of carbohydrates on a good day. Because, I look at people's food diaries before they get started, it's like 350, 400 grams of carbs a day. Like,
Well,
I
that
wonder, I
fatigue,
wonder.
because
Yeah.
they're fatigued. And the other thing is that, a lot of times can be one of my patients who I got consulted with, diabetic, senior citizen. They were going to put her in a nursing home, but they said, we're going to we'll meet with you as one last chance. So she
Wow.
was having panic attacks and anxiety. She was on Xanax to calm the nerves. And I'm looking at her drug regimen. I say, she's on, and I'm looking at her 3 month sugar average wasn't that bad. I'm like, why is she on all these drugs? And I said, let's put a continuous glucose monitor and just see. And so what was happening was that, and she said the old doctor says she doesn't need it because she's not on insulin. I go, let's just see. Let's just give it 2 weeks. Day one, we saw it. Whenever she took her glipizide, which is a medicine for sugar, her sugars would go super low. And then she would have panic attacks because of hypoglycemia. They put her on Xanax and all these meds to snow her all day so she wasn't exercising. Now she's walking. She doesn't get hypoglycemia. We got her off that drug, changed her diet, and she's exercising, laughing, and right? No panic attacks. No, it wasn't panic attacks. It was hypoglycemia. And so many of us are getting this reactive hypoglycemia from eating all these carbohydrates. Then we're exhausted. I need more carbohydrates to get me energy. And then you're in a nightmare situation you can't escape from.
Yeah, exactly. And quite a lot of young people that I have seen. So, early 20s, that is what they're coming with. They say that they're having panic attacks and anxiety, and they can't cope, and they're like waking up in the night. And when you look at what they're eating and how their blood sugar is, it's just up, down, up, down, up, down. And I'm like, no wonder you feel the way you feel. Look at this. And then I also see it in people who come to me who might have said, listen, I've been doing a ketogenic diet for a while now, but I'm not feeling great. I feel like I'm getting hypoglycemia, but my keto or my glucose looks okay on the meter. Like, what's going on? And it's because they're not keeping a close eye on their electrolytes. Now, we don't know that much about electrolytes research. We've got some research, but like in terms of ketogenic approaches, the research is not really there. There's a lot of trial and error, but some people who come and they're not looking after their electrolytes, they get these kind of what feels like hypoglycemia because they don't have enough electrolytes, their adrenals kick in, adrenaline kicks in, and then their heart rate's racing and they feel awful. And then once they're able to kind of figure out the best way forward for them, then they feel much better. So I often say, I wish we could kind of, that game of Operation. Like, I wish we could just like open up and have a look inside and being like, oh yeah, that's a little low, that's a little high. We need to switch this around. But we can't do that. I wish we could, because we'd be a lot better off. But there's just so many things that need that kind of personalized tweak. And if you don't know, then you only know what you know, right? You need to kind of do your research or work with somebody who has an idea as to how, what might be going on for you so that you can know that you can feel better, have hope that you can feel better,
Yeah, and that's an important Dr. Unwin, the power of hope and just thinking you can get better, because and it's not only that, I have family members, I'm treating a patient with schizophrenia and her husband, like how his life changes, her mom's life, worried about her, getting hospitalized and, doing, hearing voices and yelling at the neighbors, whatever it might be in a social situation. And to give them hope, say, look, let's interview. I've interviewed 3 or 4 people that have a struggle, and you've dealt with them with Metabolic Mind and all these other organizations that are coming out now saying, look, let's try to minimize our dependence on medications. Let's try to minimize our dependence on food and all these other things to feel better. So it's remarkable what you're doing. It's amazing to give people hope and say, gosh, look what, and to have something concrete that you can say, look what your sugars are doing. No wonder you're anxious. And then there's not there, because there's a lot of guilt and shame that comes with mental illness and bipolar disorder and schizophrenia. People, feel guilty or that they're doing something wrong. And to give them hope is a huge, huge thing.
Yeah, absolutely. You hit the nail on the head there because, when I listen to the stories of people, and it's the same as like the patients that I used to work with on the inpatient units, like everything is being done to them. They are being given a diagnosis. They are passed from pillar to post with different professionals. Like, oh, CBT didn't work for you, or DBT didn't work for you, or this medication didn't work for you. Like all these things that they never agreed to in the first place that are being done to them, and then they don't work. So then they feel like they're a failure or that they failed. And then, they're living on benefits, and they are, they've fallen out with their family. They don't have relationships. They don't have close friends. They don't have a job. And so what is that existence? What is that existence for them? Like that's, and some people that I've worked with are 19, 20 years old, and they've been told that that's it. And that gets me really angry. Right?
Refractory, like you're treatment resistant, nothing we can do. Right.
Nothing we can do. Like, sorry, like shops closed. Like,
Yeah.
you're just gonna have to just,
This is
that's
your
like that.
lot for the rest of your life, and you have no
Yeah.
hope.
Yeah.
Incredible.
So for anything to for anything to then be able to say, listen, like, there might be something here that can help. Like, of course you're gonna pick that up, and of course you're gonna try that. Like, I had a young person who was 20, and they were told, this is it. And they had dropped out of university and everything. And they were like, this is it. And then after like 7 months of using ketogenic therapy, they were trialing a reintegration into university. I'm like, you can't give up on people like that. Like, no, you can't do that. And so, if that is your life, the most important thing is that just because we don't know now what's going to help doesn't mean that nothing will ever help. And I think this is what we're learning. Like, metabolic psychiatry is a relatively new field, even though some of the research has been around for a longer period of time. But these new alternative therapies, with enough work and passion, hopefully will be first line treatment, or at least will be adjunct treatment so that it's provided alongside medications and other therapies. So I suppose this is more so for your listeners, that if you're feeling like there is no hope, that there definitely is. It's just, how quickly can we get this to be accessible by all, and how quickly can we get the research out to really have everybody on board, you know?
Yeah, and I even laughed when you say alternative therapy. This is what the standard was. Like, this is what
Right,
we ate before when you lived on the farm. You weren't eating donuts and ding dongs and cookies when you lived on the farm. You did have maybe cookies, but they were homemade with good
right.
ingredients. We didn't have
Yeah,
these Frankenstein foods and all these things. And then we wonder, oh, I wonder why this is happening. And so it's
yeah.
amazing when you say this is controversial to tell you to eat what your grandparents or great grandparents ate, right? And that's what your heritage is. If you're and different cultural groups, you may be used to eating different foods. The microbiome changes, everything changes based on what your nutrition is. And so hopefully people listening, this will give people hope. And the other thing
Mhm.
that's wild is another recent study came out showing that bipolar disorder improves with carbohydrate restriction and I it's interesting, even in my own case, my mom, who I love dearly, she struggled with bipolar. It's always been a stigma. She didn't like talking about it. But always during the holidays, she would cycle. It would always get out of control after Thanksgiving and Christmas. You go, "Ah, it's the sugar. It's the sugar." I always thought, man, it's just that's when she cycles. Then I start talking about that. I start thinking about my patient. I go, this person's bipolar gets worse after the holidays. This person's depressed every January. And you're in Southern California, so it's not like they're in the winter snow and everything. So you start realizing, oh my goodness, when people start eating really poorly, and their diabetes, I would diagnose diabetes always in January because the holidays, their metabolic stuff pushed them over to that edge. And you go, gosh, it's not just a coincidence. Plus, there's increased stress and family dynamics and all that
Yeah.
stuff during the holidays. But you start looking and go, how much is it that and once I started looking at metabolic health, so many of my patients in January are not depressed, they're not having bipolar, their schizophrenia is under control, and they stuck to they stuck to it. Their nutrition, the stress wasn't any difference, but maybe the way they dealt with it, maybe their
Mhm.
exercise stayed up because they weren't just sitting around eating all day and feeling lazy and tired. All of these kind of factors that what you talked about too, and I love that pyramid approach of saying, look, it's sleep, stress, exercise, relationship, community, and all these critical things that are so important to us.
Yeah, absolutely. And I like that pyramid, because if you get somebody to the point of having addressed all of those, so the nutrition on the bottom and then the other metabolic therapies, if they have if so that you can look at those as all individual tools. And so if you're using all of those tools, then if one of those tools goes out the window, so nutrition goes out the window because it's Christmas, or exercise goes out the window because you sprained your ankle or something, you still have all the rest of those tools that are going to hopefully still hold you up and get you through that situation. Whereas if you're just relying on one thing, like it's only nutrition or it's only exercise or it's only medication, okay, it can be helpful to a point, but what are you going to do if you falter? What are you going to do if you feel like somebody force fed you carbs because you couldn't say no because your grandma made pie and you feel guilty, whatever it is? Like, what are you going to do? Your ketone's going to come down, you're going to feel terrible. Okay, but if you have all the other pillars in place, which takes time, right, to like get that into your routine. But if you have all of those, then you have a really stable foundation that can weather most storms. Yes, there might be something. For example, I have one or two people who are based in California, and the fires, that was the most tragic thing. I think we could all agree, the most tragic thing for so many families. That is an incredible stressor. And, you know, that's going to take most people down, even if they
Mm-hmm.
don't have a mental health diagnosis, right? It's
Mm-hmm.
stressful and overwhelming. And yet the people that I've worked with have done, like, yes, their anxiety went up. Yes, their depression levels went up, these types of things, of course, but they're still turning up. They're still doing it. They've got an emergency plan. They're still working on all of those elements because they know they're the non-negotiables. You got to keep
Mm-hmm.
ticking those boxes because that's what's going to keep you stable and strong and see you through the other side. And they're doing an
Yeah.
incredible job at it.
It's what you're saying is if you're driving, you get a flat tire, you don't get upset and puncture all your other tires. You just change that one tire and still
Yeah.
ride on the other tires. And you keep those with you, right? So sometimes there's going to be the front tire or the back tire. You're going to have to change one of those tires. But if you have three more tires, you're going to do a lot better than if all your tires are flat trying to drive down the road, right? So yeah,
Exactly.
these are all so critical, and you're doing such great work. How do people track you down? I knew this hour would go by too fast, so I'm already starting to get a little depression. But how do people track you down if they want to use your services and or on social media wherever we can?
Yeah, absolutely. So you can just put my name into Google because I think I'm the only one that pops up there because I've got a bit of a strange name. So you can put Erin Bellamy into Google, but you can find me on Twitter and Instagram, Erin Louise Bellamy. But also if you are interested in like one-to-one or the group program that I mentioned, you can go to IKRT, so Integrative Ketogenic Research and Therapies. It's a tongue twister. That's my private practice. And you can find out more information there and get in touch. So it's www.ikrt.org. And you can, get up to date with what I'm doing. And also you can stay up to date with any of the research that I publish as well, because I'll send that out, whenever things finally make it through peer review, you'll be updated as well. So if you're a clinician or like a non-prescriber and, you want some education, then you can stay up to date that way. So yeah.
Awesome. And then we'll put links in our show notes and everything. So some people like to hear it audibly and other people like to
Yeah.
look at it. So we'll have it in the show notes and it'll be on, YouTube and wherever else, whatever other platforms we have, we'll have it in there for you so you can go and listen. But people
Brilliant.
listening, this is like really, really important stuff. I mean, I think this is our biggest epidemic I've ever seen of depression, anxiety, bipolar disorder, and there's so many factors involved. So there's so many important things that we're talking about. So if you have a friend or a family member, a coworker, whatever, whoever it is, that's struggling, a spouse, share this with people. Share this episode because I think it's so critically important because of all the things I treat, there's nothing better than seeing someone without hope and depressed and anxious, laughing again and smiling and seeing a different look in their eyes. So it's so important. This is really, really important because everything else we're dealing with metabolic health hinges on our mood and how we see the life, how we see life, counting your blessings, gratitude, all these things that seem so silly that are really critical to our mental and physical well-being. So Erin, thank you so much for joining us, and I hope people will reach out to you that need help. And I know you have a new study coming out of some of your experience with your group settings and all that, and we'd love to have you back on to talk about, and hopefully we could drag Tro out for the next one.
Yeah, brilliant. Thank you so much, Brian. It's been a pleasure, and I'm just so glad that I can reach your listeners and hopefully one pass that message of hope along. But like you said, hopefully they pass it on to the other people that they know so that, everybody can remember that there's something out there, something can help them, and that they must remain hopeful. So yeah, thank you so much, Brian.
Awesome. Have a great weekend. Thanks for joining us late on Friday afternoon for you.
No worries. Thank you so much. I'll speak to you soon.
All right. Take care.
Bye-bye.
If you enjoy the show, please consider supporting us on Patreon by going to lowcarbmd.com.